you're moving from place to place, place. Good morning, good morning, morning, good morning, morning.
Good morning and welcome back to Youth Wednesdays. My name is Dwayne and you're viewing us here live here for Scarborough. This is Tobago Updates Youth Wednesday on Wednesday. This morning we're going to take the discussion to dental hygiene and dental health. And to have that discussion this morning, we have none other than Dr. Dominique Baptiste. Certainly no stranger here to us at Tobago Updates. Good morning and welcome.
Good morning, everyone. I'm just here to have a conversation with Mr. Nurse about dental care, dental health, the services that we offer at the health centers across the RHA, and possibly any questions that you may have, that people may have asked you, questions that your family may have had, I can answer.
Certainly. So just tell us a little bit about yourself and what you do at the Tobago Regional Health Authority.
Okay, so I am a dentist with the RHA. Currently, I'm stationed at Scarborough Health Center. We provide services for predominantly children of all ages. So we have cleanings, we do our fillings, extractions where necessary, and all of these are for the children by appointment. For adults, all we would do for the adults are extractions in terms of a procedure. But we do perform examinations on them and identify and treat any issues that they present us with.
Understood. Dental hygiene, dental care. How would you define dental care?
Dental care, to me, is any measures that we would take to maintain the health of your mouth. So not necessarily just the teeth. So of course we have the oral hygiene with the brushing and the flossing, and of course it's important that you do go to the dentist 6 monthly for your checkups, But there are also certain habits that we try to encourage the people to avoid, to prevent any issues, So a major part that I just spoke about was going to the dentist. So we think that dentistry is all about getting your teeth clean, getting your fillings, possibly doing some extractions.
Yeah, but I think that is the scare, the latter part, which is the extractions. Because sometimes it's like going to the doctor. You go to the doctor just to do a basic checkup, and then I have this, I have that. You need to extract this teeth. You have to do a filling, and people have this phobia about pins in their mouths. So how do you deal with that, and how do you get people to understand that it's not just about the extractions, you're helping them to remove that fear, so they feel comfortable?
So my advice has always been keep up with your regular visits. So extraction is usually our last resort.
Right.
Yeah. So there are many things that we can do before we get to that point. So that's why we stress that you continue, you go, and we identify issues before we get to that point, So that's not what we're about. We actually don't like taking out people's teeth. We encourage people to keep their teeth all the time.
Right.
Because teeth are so important, not just to smile, not just to eat. It also maintains the structure of your face and it keeps you looking youthful.
Right.
Yeah, so you lose your teeth, the entire lower portion of your face, it collapses.
Yes.
Yeah, so
clearly.
We see older people and we think that they look like that because they're old. But a lot of older people would have lost their teeth, and a lot of times it's because of a lack of education and they didn't know better and they didn't know how to preserve.
And while we're talking about education and preservation, how does one preserve their teeth, till 75? Because, it's around that age, you see a lot of persons putting in the dentures and so on. What is a very good age to start to maintain your teeth so that you have that longevity?
I would say that the dental care should start from the very first tooth that a child would get at around 6 months old. So then the responsibility, it begins with your parents.
Right.
Yeah, so they have to take care of that child. And we think that you're not supposed to brush children's teeth. That's why we have those tiny little toothbrushes, and we have to brush the teeth, and we have kids' toothpaste. And we could educate you on the appropriate amount to use for the age of the child. And you go on as children into adulthood, you maintain the oral hygiene, you come to us, we tell you exactly what you need to do. Yeah, we can give you very personalized information as to what you need to do based on how you present. Yeah, and then you maintain that you come to us
Yes.
every year, twice a year. Yeah, if you can.
Right.
Because I understand that that may not be possible in every case, but as much as you can, you come to us for us to check, and we identify issues and follow the advice, and that's how we prevent
Yes.
those
Yes.
issues.
So brushing the teeth seems to be the first and most important part or factor of ensuring proper hygiene. Then then we have flossing as well. There has been a lot of tutorials about how one should brush their teeth. Is it still the same circular motion up and down side? Well, how do we properly brush with teeth?
I would prefer if you use the circular motions, like you're just gentle with it. So, we like to say we're scrubbing with teeth. It's not a scrubbing thing.
Right.
Yeah, the plaque that we are, and food particles that we are supposed to brush off, they are actually quite soft. So we recommend a soft toothbrush, no
Really?
hard or medium. Yes, we
I
love
just use hard toothbrush because it just feels so clean after.
Oh no.
But what does that do to the mouth?
So the hard and medium toothbrushes, over time it wears away at your enamel, and you need it, and you end up with tooth sensitivity after a couple of years. It's not
Right.
you're not going to wake up in the morning and just have it suddenly. So after using these abrasive toothbrushes for a period of time, you lose enamel, you actually end up brushing away some of your gums and exposing the root of the tooth, which
see.
results in more sensitivity. Yeah.
Yes. What are some of the mouth diseases one would incur should dental hygiene not be maintained, and what are some of the signs we could look for when we just to indicate that we have these things and treatment?
So the first thing that you see if your dental hygiene is not where it should be is gingivitis. Yeah, so we start off there and you end up with bleeding gums. So that's something that we hear about every single day, and we tell people like you need to take care. So you end up with the bleeding gums, you may end up with pain in your gums, right? And you're also going to see a buildup happening around the teeth, particularly in the lower anterior area, down to the gingiva, down to the gums. Yeah. So we see all of these things, and gingivitis left untreated develops into what we call periodontitis. And that's when the gum disease is no longer just the gums, it actually goes to the bone surrounding the teeth, and you lose that bone. You don't get it back, your teeth start to shake, and you could have an otherwise healthy tooth, no cavities or anything, and they come out.
Wow.
Yeah.
Wow. And that's dreadful.
Oh yes, I've had a patient come to me with a tooth in their hand.
Oh Lord.
It came out and they said, put it back, please. And I couldn't. I couldn't.
Wow.
So let's prevent these things. Let's take care of the teeth.
And as we are winding down with this segment of the this discussion this morning, bad breath. We know might be a plethora of reasons as to why persons might have bad breath. We have, I think, kidney disease is I think so, is one of those indicators.
Acid
However,
reflux even.
right.
Yeah.
Right. As it pertains to oral hygiene, what are some of the things to look out for to prevent bad breath? Because bad breath is a ubiquitous thing, concern for everyone.
Oh yes, it is. So what you can do, again, follow the instructions. Make sure that you floss. Make sure that you brush. Yeah. Take your time. Make sure that you're brushing every surface of every tooth. I tell my patients this all the time because we have a tendency to feel like we should only brush the front. We have to get down to the back, all the surfaces, and we have to make sure it's clean. And of course, brushing the tongue, taking your time.
One answer, one question. One answer, one question. Okay. How often should we floss?
I would say you should try to floss after every meal.
After every meal.
At least after every meal.
All right. All right. Oh, I have a question here for you. Quite provocative. However, a viewer would like to know: can oral sex prevent or contribute to bad breath or bad hygiene, oral hygiene?
I wouldn't say that. As long as you take care of your teeth, like you make sure that you brush, floss, do well on your part, you should be okay. And provided that people are getting tested and making sure that, they're STD free, because you can't get STDs in your mouth also.
Oh yes, oh yes. So thank you very much, Dr. Baptiste. Don't go anywhere. We'll go over to a break and we continue the discussion with Dr. Baptiste, with Kayleigh Lewis. Remember to share the live, share the live, share the live. We'll be right back.
Good morning, viewers, and welcome back. It's Youth Wednesdays here on the Tobago Updates Morning Show. And this morning, we're continuing our conversation with Dr. Dominique Baptiste. Good morning again.
Good morning again, Ms. Lewis.
Okay, so we're discussing the dental health fair. Tell us a little bit about that.
So we will be having a dental health fair at the Gulf City Lowlands Mall on Friday, the 17th of November, as in tomorrow, Friday. It will be starting at 10 a.m. where the dental staff will be out and we'll be there to interact with the public, answer any necessary questions, educate the public on dental issues that we see, inform people on the services that we offer. And I would say that we had a lot of results from interacting with the public, because we have had a high influx of patients over the past year where we've been going to schools and everything, right? So for our dental health fair, we would also have, of course, the dental staff. We have a nutritionist there where they will be doing BMI calculations and they'll be testing cholesterol. You can get your blood pressure checked and your blood sugar tested by nurses also. We have games and activities and we have some attractive prizes. We have some trivia questions and we just out for a day of fun and interacting with people. We also had a competition. Yeah, we had a competition across schools in Tobago.
Well, that community interaction definitely proved to be successful since you would have had that influx of new patients. But tell us a little bit more about the in-school competitions that you all would have conducted.
So our competitions, we had a primary school calypso competition. We also had a speech band competition and we had a spoken word competition, right? So I'm just here to announce some winners that we had. So our first place for the primary school calypso competition was Chevelle Barton of Lansformy Methodist, and she will be winning a Lenovo tab, a hamper containing activity books and art and craft supplies, and I guess dinner and a movie at Movie Town. And our second place, Miss Nia Gordon of Scarborough Methodist Primary School, will be winning a Lenovo tab. In the speech band, our first place school was Wim Anglican Primary School, and each of the participants will be receiving a gift basket containing activity books, art and craft supplies. And our second place, each of the participants would be receiving dinner and a movie at Movie Town in Tobago.
Wow, definitely attractive prizes. Is there more?
Yes, we have the secondary school spoken word competitions. So we have first place and we have Jaleel Walker of Scarborough Secondary. And they will be winning a Lenovo tab and earbuds. So we do have some attractive prizes there, and congratulations to all our winners.
Okay. And at the health fair itself, would there be any competitions or is it just mainly information and interactive?
We will have activities. I wouldn't say that we have competitions where people can compete against each other, but we have some games, puzzles, and on completion of these puzzles and the trivia questions, you will receive different prizes.
Okay, so we heard about the winners for the competition. Tell us a little bit more about the competition itself and, the format that it would have taken and that's...
So the competitions would have been based on our theme for the dental fair, which was educate to elevate, right? So they had to come up with a calypso, telling people about dental care and telling them what they need to do and the importance of it, or the speech bands. So we had the little shrine in their speech bands, and it was so cute to see all of them there with their I guess I could call it a sailor hat and the colorful costumes and the spoken word, of course, which it was, it was informative. Yeah. So these winners will be performing at the dental fair. So you can come and you can see them. You can get an idea of
great entertainment,
what they did. Yes.
And in terms of the participation, were there a lot of participants? Was it a struggle to get persons to participate, or were persons eager to be a part of the competition?
Well, it was a bit of a struggle to get people to participate, particularly high schools, you know, so we know how that could be sometimes. I think it's a lot of work on the teachers, who I believe they already have a lot of responsibilities. So I don't know if it would have been them being overworked, or maybe the students didn't want to participate. I can't say the reasons. I'm not sure. But the struggle would have been to get high schools to participate, but we had primary schools.
Sure. Maybe that's something, you know, we could work on. Probably take a different approach next year. Maybe, you know, some persons probably just don't like spoken word. Probably not really that good at it.
Like we could do something different that probably they may be more interested in.
And educate to elevate. Tell us about the that theme. What was the motivation behind that?
The motivation for that theme was that we would see people would come to us with various issues. And when we tell them how it would have happened or how to prevent it, they say, you know, I didn't know. You know, I didn't know I had this option. So I said, okay, let's go out to the public and we're going to educate them so now they can know and therefore make better decisions and prevent the issues.
Okay. And what can persons expect aside from, you know, you spoke about the nutritionist and the dietitian, I believe you said?
Nutrition and dietetics, and we have nurses there also.
Okay, so what else can persons expect at the dental fair?
We have our pamphlets that we will be giving out. I think it was more so for us to interact with the public, I guess, to take ourselves out of the clinical setting, and people can see that we don't eat people, we don't be trying to harm people, you know, like we are humans just like you, and we are a friendly face behind the mask and whatever PPE we may have on. Like, it was more so to get people used to the idea of dentist as a regular person just like everybody else, you know, and the dental staff and the dental nurses, and of course, we're just there to interact with people and just let them know, like, we are here to help. We open to your questions. We're here to give advice, no judgment. We just like you.
Because we know that, you know, dentists are one of those things that persons are generally kind of, you know, afraid of, especially the little children.
You'd be surprised the little children aren't that afraid of us.
Oh, the adults are more afraid?
Yeah.
Wow.
The children come and they are very excited oftentimes, and they hop in the chair and they're just like, so what are we doing today? And then an adult would come and just like, I don't like dentists. And the first thing they say, they don't even say good morning. Just like, they just come and they sit, I don't like dentists.
Oh my goodness.
So, yeah, so you'd be surprised. The children quite open to it.
Right. And in terms of the demographic that you all are catering to, tell us a little bit about that.
Okay, so we see everybody. Yeah, we see everybody, babies, children, adults, the senior citizens, everybody, people with disabilities or anything. So for your appointments, we start making the appointments for the cleanings and whatnot at 2.5. And those appointments go up until you finish high school. Yeah, so if you go to sixth form, you're still under the program and you can come to us even if you finish up to fifth form, right? So for the 2.5, we advise parents, if you have any concerns, any questions about what's happening in your child's mouth before that time, don't be afraid to come to us. So don't feel like the clinic is only open to people 2.5 and up, you know? So come to us if there's an issue, we examine, we advise. And of course, we have our adults, where for the adults, it's more of a walk-in service, and we do extractions for them. I guess maybe they said that adults work in and they could go pay to get their teeth clean. I don't know. You know, so they could come for the extractions, the examinations, and that's what we do.
Okay, so in terms of the adults, you said, well, obviously, they probably said they're working, so they could go to pay.
Probably, I don't know if that's the reason. That's what I said. Maybe.
That's what you assume. Okay, so it's just extractions for the adults. I know sometime in the past, there was a surgeon. I'm not sure if that still exists, or if you have to go to Trinidad for that, or if we have to pay for that kind of thing. If that is the case, I'm not sure if you would know, but is there anything in place to alleviate that situation in the near future?
We actually are working on that right now. We are putting things in place for us to have the oral surgeries taking place at the Scarborough Health Center. So we are working on it. We are aware of the issue, and we are working on it. I think sooner rather than later, hopefully before the end of the year, because I've already started taking patient names for the oral surgeon. So we're working on it.
Okay, that's great. Definitely.
Yeah.
Okay, and you spoke about the competition taking place primary school, you said, and secondary school.
Yeah.
What about the preschoolers?
Let me write that down, and we will include them next year.
Yeah, because I mean, you're talking about how they're always so eager and excited to be a part, to come to the dentist. So more than likely they'll be excited to take part in the competitions.
I would love that. Like, I could just imagine whatever they do, it would just be so cute. So thank you for that. And definitely, I think we should try to look forward to seeing preschoolers next year doing something, whatever we decide that we want them to do next year.
Okay. So you spoke about oral health earlier on with Mr. Nurse. What basic tips would you give to the average person in terms of taking care of their teeth, just taking care of their mouth in general?
So I'd give the advice that I typically give to my patients every day, where I would tell them I start with the nighttime. And believe it or not, nighttime is actually the most critical time for your oral care. Like, of course, it's important otherwise, but at night, you need to make sure that you do everything that you're supposed to do. So I like to tell them, floss, then brush, and if you want to use mouthwash, find a fluoride mouthwash, and you go to bed. You do not eat or drink anything after. Yeah, so you go into bed with a clean mouth, and at mornings you get up, you have your breakfast, and after breakfast we can do the floss, brush, mouthwash, and try to at least floss after every meal. I know it may be hard throughout the day to do it after lunch or while you're at work or school, but let's at least try, to get it done.
Okay. And before we wrap up, just tell the viewers one last time about the dental health fair put on by the Tobago Regional Health Authority under the theme Educate to Elevate.
All right, so again, we are having the dental fair on the 17th of November. We will be there from 10 a.m., maybe a little before if you can. I think the mall opens at 10 a.m. So you could come in 10 a.m., come see the performances of the winners of the competitions that we had, come interact with the staff, get whatever information that we have to give out, to educate you, to elevate your oral care, to elevate the care of your body, because as I said, we're going to have the nutritionists and the nurses there talking to people also. So just come down, let's have a day, a very chill, a very relaxing day. Let's have some fun with the activities, and we are there.
Okay, thank you so much, Dr. Baptiste, for coming and chatting with us this morning about oral health and the dental health fair put on by the Tobago Regional Health Authority on the 17th of November at the Gulf City Mall in Lowlands, Tobago. Viewers, we're going to take a short break. When we come back, we're going to be chatting with some persons from the Seventh-day Adventist Mission. So remember to share the live, share the live, share the live.